Hello everyone. In this INR number 37, we are going to discuss another important PYQ that is called as androgen insensitivity syndrome. So what is androgen insensitivity syndrome? It is also known as Morris syndrome. Remember, also known as Morris syndrome or also known as testicular feminization syndrome. Right? What is this? It is a X-linked recessive disorder and mutation occurs at the X chromosome. Where will be the mutation? Mutation will be on the X chromosome. See, this is the X and Y chromosome. So mutation in the on the X chromosome, and on X chromosome also on the long arm. On the long arm also, it is on the proximal part of the long arm, right? So X chromosome, proximal part of the long arm, they will be having mutation, right? So what is their mutation? So here mutation will be affecting androgen receptor gene, because androgen receptor gene, see, this is the androgen receptor gene. Androgen receptor gene is getting mutation, then what will happen? There will be no androgen receptor will be produced. So normally this long arm of the X chromosome is producing the androgen receptor, and this androgen receptor is for the testosterone, right? So they are going to combine with testosterone under the normal condition, and there will be a normal baby development, right? But what is happening in the androgen insensitivity syndrome, that receptor is not expressed. Now you can see why this receptor has not been expressed, because of the mutation in the long arm of the X chromosome, right? So androgen receptor was mutant. So as a result, we will see the Morris syndrome or testicular feminization syndrome. What is characteristic of this syndrome? If you look at the karyotyping, they will be having 46XY. Means if you look at them, they are having male genetic sex, right? 46XY male genetic sex. But when you are looking at the development and physical appearance, remember, it is 46XY male and male genetic makeup, right? But when you are seeing their development and physical appearance, they will be like a female. So that is why this is also called as male pseudo hermaphroditism, right? So that is why it is also called as male pseudo hermaphroditism. So androgen insensitivity syndrome, testicular feminization syndrome, or also known as male pseudo hermaphroditism. So what will be the finding in this patient? They will be having normal breasts, right? Absent pubic hair, blind vagina, and absent uterus. So now you can see, as I said, breast development will be normal, right? Scanty pubic hair and axillary hair will be there, right? Female external genitalia will be present, but in that external genitalia, what you will see, that blind ended vaginal pouch will be there, right? So blind ended vaginal pouch will be there, and the dangerous thing is undescended testis will be also present, right? So male like appearance, so that is why undescended testis, and this will be the risk. This will be creating risk for the germ cell tumor like a gonadoblastoma or dysgerminoma, right? And you can see the dot line, it is showing that uterus and fallopian tube, all these things are not developed. So because of uterine and fallopian tube agenesis, what will happen? This patient will be presenting with primary amenorrhea and infertility, right? So this patient will be presenting with primary amenorrhea and infertility because of the uterus and fallopian tube. You can see uterus is not developed, fallopian tube is not developed, right? So primary amenorrhea and infertility will be there, and even ovary is not there, right? So that is what we have to remember. And testis can be present at variable location. You can see here undescended testis is there. So what will be the management protocol in this patient? We will do the gonadectomy. Why we are doing the gonadectomy? Because you can see this is undescended testis, can be a risk for the future gonadoblastoma or dysgerminoma, right? And we should also give replacement therapy. In replacement therapy, we'll be giving estrogen for the proper breast development. And for vagina, because it is blind-ended vaginal pouch, so we will be doing vaginoplasty. Macindo vaginoplasty also can be performed, or we can do the laparoscopic vaginoplasty. So keep revising this topic. It's very important PYQ. Best wishes to all of you. Bye bye.